As a young man, Joaquin Ramirez was a brilliant engineering student, but by his early 20s, he began hearing voices. His sister Alba says, in what felt like an instant, her family's hope for a bright future was shattered by schizophrenia. Joaquin is one of a rapidly growing number of patients the Cook County Health and Hospital Systems is now treating for behavioral health or substance abuse issues.
Since the moment that he takes the medicine and the support of the hospital, his life is so better.
Historically, the Cook County Health and Hospital Systems played a limited role in the provision of behavioral health services. However, as CEO Dr. Jay Shannon explains, it is now crucial for the system to expand care.
What we've seen predominantly at the state level is a marked decline in funding to community-based service providers who provide detoxification services, mental health counseling services, crisis stabilization services, and so on. Because of that, what we see is our emergency rooms and unfortunately the jail being clogged with individuals who otherwise could have gotten stabilizing treatment before they reached a crisis point.
The system is committing significant resources to fill this breach, including expanding and integrating behavioral health services into our primary care medical homes. Dr. Andrew Segovia Kulik, chairman of the Department of Psychiatry, says the goal is to identify and manage a mental health issue before it leads to a more complex condition.
If I were overweight and I didn't eat properly and I had high blood pressure, if I caught that early, then I could prevent a whole host of problems that can happen to my heart, to my kidneys, to my other organs. Same thing with mental illness. So if we have an individual who has problems and we're not identified, then the problems get worse. And once you identify them when they're worse, it's harder to treat.
With early intervention in mind, this year's CCHHS established its new Community Triage Center, a facility in the Roseland community on Chicago's South Side that is open around the clock to provide behavioral health stabilization and support.
This CTC is in a high-needs community. It will be open 24 hours a day, 7 days a week, 365 days a year. It has a diverse and dedicated staff. People who are deeply troubled in body or soul can come here or be brought here, and they will be received, served, and comforted.
Dr. Kenya Key is Chief of Psychology at Cermak Health Services, a division of Cook County Health and Hospital Systems that provides health care at the jail. Dr. Key says that CTC aims to reduce jail population where nearly 1 in 4 inmates has a diagnosable mental health disorder.
When we're providing services in jail, it's not the best case scenario. It's a needed scenario because of the number of mentally ill people that we have, but it's just not a therapeutic environment. Our staff work extremely hard. I think we provide an excellent level of care, but where the care needs to happen is in the community, where other supports are in place, before the individual's life is interrupted by the cycle of incarceration.
The third prong in the system's behavioral health plan is expansion of medication-assisted treatment for people with alcohol and substance abuse disorders. Overdose death rates have exploded across the country the past several years, and Cook County is not immune. The county saw more than 500 heroin and fentanyl deaths in 2015, more than double the number of traffic fatalities.
One strategy includes education to individuals and family members about how to use naloxone if we're taking care of an individual who's at risk for an unintentional opioid overdose in the hopes that this will save their lives. Secondly, we're expanding the use of what's referred to as medication-assisted treatment. These are specific, evidence-based strategies to help people with opioid problems, with other kinds of illicit drug problems, and with alcohol abuse to get on the road to recovery and to getting to a more therapeutic plane with their primary care provider.
Aurora Prado, a nurse clinician in psychiatry, sees every day how important it is for behavioral health conditions to be treated as the medical conditions they are so patients can heal and thrive.
Even in this day and age, psychiatric mental illness remains a stigma in our society. How we look at our services is that we treat it just like any other medical condition. These illnesses are treatable, and they can live a productive life when they are stable on treatment.
By building up a network of community-based services, the Cook County Health and Hospital Systems is a beacon of hope for families struggling with mental health and substance abuse issues.
If we can change one life, if we can get one person stable and back into the community and not come back through our doors, then we've done a great job.
Well, the key is that when you've got that effective safety net that's close to where a person lives, that's culturally congruent with that person, we find that what they're able to do very often is regain control of their lives.
Since receiving treatment, Joaquim's life has stabilized. Friends say every now and then he seems like his old self. Elba is grateful to get a glimpse of the brother she remembers.
When I've been talking with the person in charge about my orientation or the information, she said, "We can help you." And since that moment, we get the support. The cost of the medicine is less. And for me, it was a release because I love my brother. And I can say, thank you, good God.